issue. So nobody really likes the O words, overweight, obesity, but carrying excess weight really puts us at risk for diabetes, but also we're understanding a lot more about the risks of cancer, about the risks for heart disease. So it is an issue that people should pay attention to, and it is not just an issue about cosmetic or, how we look in our clothes. It's a health issue. So I think making an effort towards healthier eating, towards exercising, we know that physical activity is so important, not just for weight loss benefits, but for health in general. And really making this a priority for those who have families, teaching their children about healthy eating, going out for walks and making exercise a part of family time. I think these are the things that our society really needs to focus on.
In your leadership role at the Brigham and Women's Faulkner, you're the medical director for the weight management program. You're the co-director at the BWH Weight Management and Metabolic Surgery Department. The list goes on. So what do you say about weight loss surgery? Give us an update on sort of the latest procedures or what you're a fan of and maybe what you're not so keen on.
Well, weight loss surgery has really emerged as a very successful treatment for obesity. And a lot of my research has focused on the effect of weight loss surgery, not just on weight, but also on improvements in diabetes and other risk factors for heart disease like high blood pressure, high cholesterol. So I do recommend to my patients weight loss surgery when it's the right treatment for them. There are cutoffs in terms of body mass index, which is how we define medically the terms overweight and obesity. And people need to meet those cutoffs in order to have the surgery covered by their insurance. People also need to feel prepared and be willing to make all of the changes and all of the follow-up that this requires. So it's definitely not right for everybody. But for some people who really want to do something about their weight and who have struggled for a long time with other efforts that haven't been successful, I think it can be a very good and life-changing experience. There are different options, and I probably shouldn't get into all the details, but it's very important to find a surgeon that people feel very comfortable with. The Brigham and Women's Hospital and Brigham and Women's Faulkner Hospital have a bariatric program that's outstanding, and I work very closely with them. And then each individual has to feel very comfortable in the discussion with their surgeon about what is the best choice for them.
For those of you who are just joining us, good morning and welcome to Exceptional Women, radio portraits of women who will inspire you. I'm your host, Candy O'Terry, and in the spotlight, Dr. Florencia Halperin. She's the chief of endocrinology at Brigham and Women's Faulkner Hospital, and she's devoted her practice and her clinical research to obesity, diabetes, and their unique connection with lifestyles, especially for minorities. So explain that last phrase to us, especially for minorities. What has your research shown?
Well, I can kind of put a personal spin on it, which, as we've been talking about, I was born in Argentina and Spanish was my first language. And so when I did decide to become a physician, I felt that I have this special kind of additional knowledge of this other language. And some of the conversations, as I've been saying, that we have with patients around these issues are so difficult that it's a huge benefit to do it in the language that's native to them. And it's not just about language, it's also about culture. So I really feel that because of where I come from and because of the knowledge that I have a special bond with the Latin community and feel very strongly about sort of paying it back and being able to do something to improve this aspect of our community. It's also true that diabetes and overweight disproportionately affect Hispanic minorities. So a lot of my practice is in patients who are of, Hispanic background, who are Latino, and who want to address these issues in a culturally relevant way.
You have been a mentor to residents and to your peers at the Brigham as a teacher, as a lecturer. So that must be especially rewarding for you. What do you give? What do you get when you're in that kind of a role where you're a mentor?
Well, it is one of the best parts of my job.
I wish people could see your smile as soon as we started talking about it. I can tell you love that.
Yes, well, it's just so exciting. First of all, you've actually learned something in your career, and it's great to be able to kind of look back at where you were, in this stage of the person is and share. And each individual is different, and so we have to really kind of help them be who they want to be. So it's just really fun to be able to kind of share your knowledge, share the relationship that you've had with your patients, share what, fuels your passion, and then help them find what those special things would be for them. And lecturing, I do always get a little bit nervous in the beginning, but it is really interesting to have gained expertise in something and to be able to share it with colleagues. And the one thing that I can always say when I give a talk that not everybody can say is that I know my topics are relevant to every doctor in the room, because every doctor in the room is taking care or has taken care of or will take care of a patient with obesity. And so that's a very motivating factor for me, that I know it's really important for every doctor and every medical student and resident to understand a little bit about these issues because they're just so prevalent.
What's the best part of your job?
Definitely those days when your patients are grateful and when you feel like there is something that you have done that has helped. I'll tell you one example that I thought of. I have this wonderful patient who came to see me when she wanted to have a baby, and she had thyroid issues and she had high blood pressure. And she, because of those conditions, was nervous about the health of her pregnancy. And so we changed around her medications and we monitored her very closely. And when she emailed me that she had given birth to a healthy baby girl, I went to visit her in the hospital. And that was the first time that I was meeting her husband. And her husband said, "Oh, Dr. Halperin, it is so nice to meet you. I feel like it's because of you that we've been able to have this healthy baby." And although it isn't true and I can take no credit, they did all the work. It was just one of those moments where it was like, this is what I do and why I do it.
Any advice for young doctors who are working this morning in hospitals all across the Boston area? What do you wish you knew when you first got started on this journey as a doctor?
Great question. Well, I think it is important to know that it is difficult and that you do make sacrifices or exchanges along the way, because you have to be prepared for those. And then I think it's really important for young doctors to really find that chemistry. What is it that they love about their job that's going to make them happy to go to work every day? So is it a research project? Is it a specific specialty or a specific group of patients? I think everybody has to really work hard to find those most motivating aspects of the profession so that they can continue to do it in the long term and be happy.
You had mentioned when we first got talking that you have a bilingual household. You've got 2 children. How did becoming a mother change you as a doctor?
Oh, that is a great question. So I have 2 very little children, and they are the best thing about my life. I think being a mother changed me a lot as a doctor. Even though I don't take care of pediatric patients, I think it just gives you a different perspective on life about what's important and setting priorities for yourself and your health. And also, they are such a science experiment. It's so fascinating to watch them develop and to think about how we've all been through that process and how we need to teach our children to be healthy, both emotionally and physically. So it has had a huge impact in kind of wanting to make me do even better.
So what would you say if one of your kids turned around 18 years from now and said, "Hey, Mom, I want to go to medical school. I'm a bio major now." What do you say?
Well, my husband and I have talked about this at length. We will encourage them and support them to do anything that they want to do. I heard another doctor give a talk once, and she said, my children had all the choices in the world. They could be a dermatologist. They could be a pediatric oncologist. We will definitely be open to whatever they want to do. But my husband is also a physician, so they will definitely be exposed to medicine and working parents and all those kinds of trade-offs.
When I first started preparing to meet you and for this interview, I received something called a CV, which is a curriculum vitae, and it's pages and pages and pages and pages and pages of what Dr. Halperin has done with her life. And it's pretty extraordinary, and you're still a young doctor. Any long-term goals that you're still striving for?
Well, it's been very exciting to be given the leadership positions that I've been given in the recent years, and we really want to see our new Center for Weight Management and Metabolic Surgery grow. And I'm very invested in my role at the Faulkner as the Chief of Endocrinology and doing better for patients with all kinds of endocrine conditions. So I do have a lot of growth still in my career. And also my research projects have been really exciting and continue to flourish. But probably the greatest challenge is what we were speaking about before, which is finding balance between my home life and being a good mom, and also being really devoted to my career and being able to give my patients and my projects all the attention and time that they deserve.
Well, I want to say thank you so much for sharing your story with us. I know you were a little bit nervous and you did just fine.
Thank you so much. You've made me feel so welcome. And thank you for all the very thought-provoking questions.
You're so welcome. In the Spotlight, we have been listening to Dr. Florencia Halperin. She's the chief of endocrinology at Brigham and Women's Faulkner Hospital, and she has devoted her practice and her clinical research to obesity, diabetes, and their unique connection with lifestyles, especially for minorities. Congratulations on being this week's Exceptional Woman on Magic 106.7.
Thank you so much. It is really an honor.
And that's Exceptional Women for this week. If you know a woman with an interesting, inspiring story, we really want to hear all about it. Just go to magic1067.com and click on Exceptional Women. We've got an entire library of podcasts, and they're right there too. So even if you miss a show or you want to hear this one again, you're all set. Again, just go to magic1067.com. This is Magic's Candy O'Terry. Please join Sue Tabb and me every Sunday morning at this time for another edition of Exceptional Women, radio portraits of women who will inspire you.